Brain Tumor Center is a major initiative here at Barnes Jewish Hospital, Siteman Cancer Center, and Washington University. And that's a multidisciplinary effort, multiple departments, neurosurgery, my department, medical oncology, your department, radiation oncology, pediatrics, neurology, pathology, radiology. All these different departments are all aligned, all working together.
What you have is a multidisciplinary team, and what is that really? That's talent, that's technology, and that's science. No single aspect of those things is enough. It's really all of those things together in multidisciplinary fashion that can really help that patient. We don't only want to slow down a cancer like glioblastoma, we want to completely obliterate it, And so for things like that, we really look towards clinical trials. And maybe in the future that gives us a new standard of care, a new way to cure people.
Right now, the standard treatment is surgery to take out as much as possible, but it's such an invasive tumor that surgery is not curative. And then we administer radiation to kill some residual cells combined with a chemotherapy. On average, after all of this maximal therapy, patients have a recurrence of their tumor just within 6 months. It's quite devastating a disease.
The Brain Tumor Center is designed to be, an umbrella, and lots of different things are underneath that umbrella. And what's exciting here is that we now have well over 10 investigators who are dedicating their scientific efforts, their professional lives, towards improving the care of patients with glioblastoma.
It's great to be in such a collaborative environment, and the Brain Tumor Center really just solidifies all of us, the many different prongs of clinical and scientific approaches to combat this disease, and really advance new ideas for cancer overall. I work very closely with Mike Diamond, who's an international expert on flaviviruses, a class of viruses, and it was really conversations together that initiated the possibility of using this, dreadful virus for something positive. Because brain tumors are so difficult to treat because there are specific cells within the tumor that are highly resistant to all of our usual therapies, just reading articles in the newspapers about Zika virus and the dreadful problems it was causing in developing brains, we asked a simple question: can the virus be used to find, target, and kill these otherwise resistant tumor cells? And it turned out that it could. We're really excited about leveraging something from nature, harnessing it, engineering it, and then using it to leverage other FDA-approved agents. Last week, enrolled a patient to a clinical trial that it's to make vaccines where they take the patient's specimen from the operating room and in the laboratory generate a specific vaccine for it.
We work with our collaborators to try to figure out what is special about the tumor and what the immune system might recognize in that tumor that's different from normal tissue. And then we actually put together a vaccine based on those components and then treat the patient. I don't think you can do these trials at a lot of places, and I think we're very fortunate to be here because we're able to do that with the infrastructure we have here.
What we do here is advanced functional brain imaging. And that means not just taking a picture of the tumor and knowing where it is exactly in the brain, but knowing its relationship to things like where is the motor area. These advanced brain mapping preoperative imaging protocols that we have that you don't get anywhere else. A lot of this was, for instance, spearheaded by Dr. Eric Luthart, Dr. Josh Shimoni in neurosurgery and neuroradiology respectively. And we've been using these different imaging protocols to help us really hone in on how to make the safest surgery to get the most tumor out. When I tell my friends actually in other academic centers that we're doing this, it's sort of advanced imaging, they're like, no way, that's just science fiction. And but we've been doing it for the last several years, and we want to make it even better.
That was possible in part by philanthropic gifts that really got the seed money to get that going.
We need more than just stepwise advances, and philanthropic funding allows us to take the most important, crazy, riskiest ideas and really advance them.
There's no question. I don't think you can initiate early ideas, novel ideas, without resources and support. And we have been extremely grateful to benefit from philanthropic contributions to create a foundation to make our vaccine trial happen. And that ends up being a fire starter, an accelerator for other forms of support. You know, creating momentum from 0 miles per hour is one of the hardest things we do. To have that kind of generosity and contributions to our efforts, it's a nidus for the progress we need to make.